All right, welcome back to ABA exam review and the continuation of our BCBA practice exam series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Be sure that you check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A trainer wants to improve a client's adherence to a new workout plan. The trainer decides to use an ABAB design where baseline is measured for 1 week, followed by a reinforcement-based intervention for 2 weeks, then a return to baseline for 1 week, and finally a reintroduction of the intervention. What is the primary purpose of reintroducing the intervention? So the question is asking specifically about the reintroduction of this intervention. We know we have an ABAB design. So we have a baseline, 1, then a intervention, 1, baseline, 2, intervention, 2. So for this, we have to think about baseline logic, our predictions, our verifications, and our replications. And when we think prediction, verification, and replication, what is the primary purpose of our second return to intervention? Is it A, measure generalization of behavior change? Well, no, we're still in the intervention phase, right? We're not yet looking at generalization or maintenance. B, to promote response maintenance after intervention. Intervention is still going on, so we're not yet testing maintenance. C, decrease the impact of confounding variables. Potentially, right? But just by reintroducing the intervention doesn't necessarily decrease the impact of confounding variables, although it can reduce the likelihood that confounds are affecting our functional relationship. The real reason we do it, or the primary reason we do it, is to replicate the effect of the intervention. Through replication, we're starting to establish a more apparent and certain functional relationship between our dependent and independent variable. And through that relationship, we're starting to rule out confounding variables. So the primary purpose is replication, which leads to making other choices about functional relationships and even confounds. Clinic supervisor reviews data showing that a technician is correctly implementing a behavior plan only 40% of the time. To address the issue, the supervisor provides retraining and observes the technician directly. After these interventions, procedural integrity improves to 85%. What should the supervisor do next? So, supervision question and a procedural integrity question. What do we know so far? The supervisor at first show or reviewed data that show that a technician correctly implemented a behavior plan 40% of the time. Obviously, very low. So the supervisor goes through retraining and then gets the integrity up to 85%. Much better, but that still leaves 15% of the time where the procedure is not being implemented with integrity. So at this point, what does the supervisor want to do next? A, stop collecting data and focus their attention on other issues. Well, we're still only at 85%. We want integrity pretty much at 100%, right? Because that other 15% means the procedure is wrong. B, brainstorm ways to fade out any reinforcement that is currently being delivered. Okay, maybe potentially, right? But the supervisor is making good progress, right? The intervention is effective, and we're still only at 85%. So we still want to strengthen that behavior. C, praise the technician, but then warn them about possible punishment if integrity gets that low again in the future. Well, we're not going to start threatening punishment for something that may have been a training issue, given the fact that training occurred and integrity immediately jumped up. So D, provide additional feedback and continue monitoring integrity until it improves even further. Yes, we need to continue giving the feedback and we need to get that integrity up, closer to 100%. Once we're closer to 100%, then we can think about fading reinforcement and fading out the intervention. You and your friends go to Las Vegas 3 times a year, typically in January, March, and October. You love the trips for 2 weeks after the trip is over. You have no desire to go back to Las Vegas in the immediate future. What does that play relative to your desire given this information? Now, let's think about the question is saying. It's asking about what is going on relative to desire, because desire is very mentalistic, right? It's a state of being. I guess you could argue it's a feeling, but it is very much a mentalistic idea. Now, when we talk about desire, though, in behavior analytic terms, we're often talking about what we want and don't want, and what affects wanting and not wanting in ABA. Well, motivating operations. In this case, if you go to Vegas 3 times a year, you like Vegas, but 2 weeks after the trip, you have no desire to go back to Vegas. What's happened? Well, the value of going to Vegas has decreased. Why? Probably because of satiation. So in this case, what is in play relative to the desire, the want to go back to Vegas? A, an establishing operation. An establishing operation increases want, right? It increases the value of something. Here, the value has gone down. B, an evocative effect. Well, an evocative effect is not going to be related to the desire, but rather the behavior. Same with an abative effect. These two, evocative and abative, are related to the behavior, while these two are related to the value. So if we're talking about the value or the desire, we're going to be talking about an establishing and abolishing operation. Since your desire has gone down drastically for 2 weeks, once the trip is over, likely due to satiation, very much an abolishing operation is in play. You, as a behavior analyst, should attempt to take inter-observer agreement data as often as possible. This type of data collection will help most with what aspect of data? All right, just a simple teaching question, an awareness question. When we take inter-observer agreement data, what are we collecting? What are we trying to see? Well, it's going to be 2 or more people observing and measuring the same thing, comparing those outcomes, because we want to see, are those data trustworthy? Inter-observer agreement really helps with the idea of believability. Validity, accuracy, and reliability can be improved through inter-observer agreement if, let's say, you are observing a technician and your data does not agree with the technician's, then we can check for things like validity, accuracy, and reliability. But you can have bad data, your technician can have bad data, but if you agree, at least it's believable. So inter-observer agreement helps most with believability. A casino is attempting to maximize how long people sit at slot machines. The casino manager hires more waitresses to serve drinks and increase free play promotions. After 2 weeks, it appears that people are sitting about 15% longer than before. What is the dependent variable in this situation? The question is asking about the dependent variable. The dependent variable is dependent on the independent variable. So whatever we are manipulating and controlling is the independent variable, and it's affecting the dependent variable because the dependent variable is dependent on that independent variable. That can be a difficult concept to understand at first. Just keep in mind that the dependent variable depends on what we change or manipulate. So if the casino wants to maximize people sitting at slot machines and they hire more waitresses and increase free play promotions, what are they manipulating? Well, they're manipulating how many drinks and waitresses there are, plus free play promotions. What are they targeting? Well, sitting at slot machines. So what is the dependent variable? It's going to be A, sitting at slot machines. Hiring waitresses and increasing free play will be their independent variable. It's what they're manipulating. It's what they are controlling. Andy begins practicing meditation to deal with his anger. He is supposed to close his eyes for 20 seconds whenever he begins to feel angry. Over time, Andy will also count to 10 if he is angry, or he will think about his happy place for 1 minute. Andy is demonstrating what? So let's think about Andy's behavior here, right? What do we know about Andy? We know when he's angry, he's meditating. So the stimulus is this anger. He meditates. He closes his eyes for 20 seconds whenever he feels angry. Over time, he also counts to 10 if he feels angry, or he will think about his happy place. So now we have all these different responses in the presence of this stimulus of anger. And so when you have multiple responses in the presence of one stimulus, what do we call that? We call that a response generalization. We've done enough questions so far on this particular exam where you should start to feel like you're seeing patterns in how we approach these questions. The questions are all going to be worded differently. They might be worded in a strange way. You might not even understand some of the ideas in the question, but you just need to attack each question the same way. Because if you do, you're going to develop a consistency and you're going to develop a feel for what the question is asking about. So immediately when you see, okay, I have a stimulus evoking a response, and then a bunch of new responses are popping up, after practicing, immediately you're going to start thinking about generalization. There's a reason we're so consistent on how we attack every question. You want to stay in attack mode. You don't want to let up and you don't want to get lazy. You've been asked by a client's parents to implement a new intervention that they found online. Parents claim that this intervention has been proven to be effective when used over the long term. The intervention is not currently part of the plan, and you have no experience with the intervention, but the parents are insistent that they want it included. What should you do? This is always a tough situation because, as the analyst, you are collaborating with the parents, and the parents are the primary stakeholders in most cases. When they give suggestions, we want to honor those suggestions and give those suggestions a serious consideration. Now, in this case, they found an intervention online, which is always a challenge, especially with things like TikTok and Instagram, where people are just saying all kinds of things that parents take as gospel. They say, well, it's proven to be effective. Now, they say that you've never heard of it, you have no experience with it. What do you do in this situation? Because they are insistent they want it included. What should you do as an ethical behavior analyst? A, implement the intervention as client-informed goals are important in behavior analysis. Nothing about A is untrue. However, we can't just blindly implement what these clients' parents want. Who knows what might happen, right? We need to know more first. B, refuse the intervention as the parents found it online and have no empirical support. Well, everything's online, right? It might have empirical support. We just don't know yet. We have to learn more about it. C, implement the intervention for 2 weeks and see what the data say. You could, but before even that, how about we do a little research? That's part of our job. The client comes to us with a proposal, and before we just go and blindly intervene and use it, or before we flat out refuse it, we need to do our own independent research. That's part of being a good scientist and part of being a good behavior analyst. Skinner teaches one of his pigeons to respond to a buzzer sound by pecking a blue card. Now, without further teaching, the pigeon will look at the buzzer whenever presented with the blue card. What does this demonstrate? Again, this is one of those where the more you study, the more fluent you get. These questions are really going to start to jump out to you. The question is asking, what does it demonstrate? We have a situation where a pigeon responds to a buzzer by pecking a blue card. Now, the pigeon looks at the buzzer when presented with the blue card. What does that look like to you? To me, it looks like stimulus equivalence. So if we have a buzzer sound A, blue card B, right? And so when the buzzer is sounded, they peck the blue card, A equals B. And then when presented with the blue card, they look at the buzzer, B equals A. Well, that's going to be symmetry. Reflexivity is A equals A. And then transitivity is A equals B, B equals C, therefore A equals C. This is clearly symmetry. Professor McGonagall wants to determine which part of her plan helps students perform best on their transfiguration exams. The plan includes 3 components: practicing wand movements, reviewing spell theory, and practicing with others. She first tests the entire routine and finds it improves exam scores. What should professor do next to achieve her goal? So let's think about what the professor is trying to achieve. That's what the question is asking. The question says, what is her goal? Her goal is to figure out what part of her plan is helping students perform best. Her plan has 3 components. So when we have a plan with multiple components, right, and it's one package, and we want to find out what part of the package is best, what do we use? A, conduct a comparative analysis to see what aspect of the plan works best. With the comparative analysis, remember, they're not part of a plan, right? They're all separate. Our component analysis is when we have them together in one plan, and then we can drop out or add in and look at each individual piece of the plan. A parametric analysis is a single intervention we're looking at. And of course, a reversal design is not going to eliminate parts of the plan. If we want to look at individual pieces of a solid plan, we're going to conduct a component analysis to see what aspect of the plan works best. A teacher implements a differential reinforcement procedure to reduce a student's loud vocalizations by reinforcing quiet talking and ignoring shouting. After 2 days, the student's shouting intensifies significantly. What strategy is a possible ethical solution to this problem? Now, careful here. Pretty easy question on the surface, but you don't want to go too quickly. What do we know? We know a differential reinforcement procedure is implemented to reduce loud vocalizations, reinforcing quiet talking, ignoring shouting. So we have reinforcing, we have extinction. After 2 days, shouting intensifies. Well, we know the shouting is on extinction. What is this intensification probably related to? Most likely an extinction burst. Is it predictable? Yes. Is it telling us we're likely doing things correctly? Yes. So if we want to be ethical, what is the solution here? A, increase the amount of reinforcement for quiet talking. You could do that, right? If we know extinction is effective and we really want to start to strengthen quiet talking, well, bump up reinforcement for quiet talking. What about B, continue implementing the plan as designed? Absolutely. If we're going through an extinction burst, it means we're doing something right. Don't stop now. C, switch to a punishment-based approach. Punishment is completely unnecessary here, given the fact that this looks like just a standard extinction burst. Punishment would make no sense in this situation. So what is strategy as possible ethical solution? What's going to be both A and B? Thanks for watching. Be sure to subscribe and like. Check out behavioranalyststudy.com for all of our study materials. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.